for UTI as Niftran, and the culture had shown that she was sensitive to Niftran. Niftran is an antibiotic, urinary antibiotic, and trinorm for the frequency of the urine. For 3 months she had been prescribed, and she was referred to endocrinologist for persistent hot flushes and episodic swelling. Then 3 weeks later, she went to the doctor with dysuria and strangury. The urine routine was showing pus cells fulfilled, and urine culture and sensitivity showed presence of Serratia marcescens, which was resistant to Niftran. Earlier it was sensitive to Niftran, and then the antibiotic was changed to cefixime and Baxtol. Trinorm was for the frequency. On 22nd, 3 weeks later, her urinary symptoms were less, but she developed numbness of the right hand with cramps. That was the adverse drug reaction to the cefixime. So the antibiotic was changed to Augmentin, Duo, 625 milligrams BD, Bifilac, and referred to neurologist for cramps in the right hand. So at this point of time, she was very, very nervous that she was resistant to everything, and she was having so many ADRs. So she sought treatment from us for antibiotic resistance and drug-induced effects. On 30th January, she started homeopathy after finishing all the antibiotics. She felt that, after finishing all the course of antibiotics, then she would come to the start homeopathy. So her urinary daytime frequency was very frequent, and she had pain at the end of urination. She had constant dragging sensation in the lower abdomen, and urine still showed, with all the antibiotics, full field of pus cells. So homeopathic treatment was started with Thuja 200 in the morning on Monday, Wednesday, and Friday, Lycopodium 200 on Tuesday, Thursday, and Saturday, CPR 200 once in the evening, Pulsatilla 200 twice a day. Thuja was selected for chronic cystitis, pain at the end of urination, and increased frequency. Lycopodium was selected for purulent urine, chronic cystitis, and CPR for prolapse of the uterus, and also cystitis. Pulsatilla was for acute UTI with pain at the end of urination. 6 weeks later, urinary frequency was much reduced. Pain at the end of urination was much reduced. Serratia marcescens was sensitive. See, again, the urine culture was done, and Serratia marcescens was still present, but it had become sensitive to amoxicillin while it was resistant to this particular antibiotic earlier. So we continued the same treatment, and this result gave confidence to the patient that, at least I have some antibiotic to fall back on, because still she was very not very confident of homeopathic treatment. So 9 weeks later, increased urinary night frequency with pain at the end of, she complained of increased urinary night frequency with pain at the end of urination, bearing down sensation, aggravation on exertion, constipation with stool on alternate days. Diabetic profile was better than before. And so we prescribed Thuja 200 on Monday, Wednesday, and Friday, sulfur 200 on Tuesday, Thursday, and Saturday. CPR was continued once in the evening, and Nux vomica 200 before lunch and dinner. Sulfur was selected for constipation, painful stool on alternate days, and Nux vomica for constant painful urging to urinate. 8 weeks later, urinary frequency was much better. There was unfinished feeling with pain at the end of urination continued. So we gave the same treatment was continued. Then 6 weeks later again, the urine culture and sensitivity showed absence of serratia but presence of Klebsiella. It was positive and sensitive to more antibiotics than before. And patient revealed at this point of time that she had UTI for about 20 to 25 years after her second delivery. Or much more, because 20 to 25 years, she was 74, so she had been having this UTI for maybe 40 years. See, so on the strength of, very chronic infection, we gave Thuja 1 mg instead of 200 weekly, sulfur 200 on Tuesday, Thursday, and Saturday, CPR once in the evening, and Nux vomica twice a day. 4 weeks later, urinary symptoms were very much better, but she had developed a urticarial rash, which was aggravated on scratching, overstraining, and she had overstraining and overexertion because her husband was not well, and she had to look after her husband. So Hepersulf 200 was given every morning for urticaria, aggravation on scratching, and history of urticaria. Then Rustox 30 BD and Arnica 30 BD were given for eruptions in groins with black discoloration and overstraining. CPR was continued, and CPR was given 3 times a day, once a week. Instead of every day, it was once a week. Then in October 15, yes. See, she was not very confident of homeopathic medicine, and she felt that she had taken enough, and now she was all right, and her urine culture showed a lot of sensitivity to many antibiotics. So she stopped taking homeopathic treatment for 1 month. Then after 1 month, what happened was that her urinary symptoms recurred. The skin complaints were much better, and so for this urinary complaints, she took antibiotics for 10 days, and in 10 days she was all right. But she realized that if she doesn't take homeopathic medicine, she will again have it. So she wanted to restart homeopathy, and we restarted homeopathy with Thuja 1 mg weekly, Lycopodium in the morning, and like a CPR 200 once in the evening, and Pulsatilla. She was the wife of a homeopath, and she was an experienced person. Sometimes she took Pulsatilla, sometimes she took Nux vomica on her own, but this time we had prescribed Pulsatilla 200 before lunch and dinner. In December, after 2 months, the urinary complaints, is it right? Yes. Then in December, urinary complaints were very much less, but she complained of hot flushes around forenoon. So we gave Thuja 1 mg TDS weekly, Lycopodium 200 once in the morning, CPR 200 once in the evening, and Pulsatilla 200 twice a day, because when we did, we reduced the dose of CPR to weekly dose, then she started having this hot flushes, otherwise she was well. So in March, 3 months later, there were no urinary complaints, bearing down was very much less, and all urinary reports were normal. HB1AC was maintained at 6 instead of 7, and the dose of hypoglycemic drugs was reduced. So we said continue with the same treatment. In March 16, she was maintaining well at reduced dose of hypoglycemic drugs. There was no relapse of UTI, and we said that you continue with the same treatment. In July 16, her husband was admitted in ICU, and so she developed with a similar kind of complaints. So she developed fear of similar fate, that she may also go into ICU if she is not careful. So we gave her a dose. We gave her Calcarea 200 once in the morning for fear and anxiety about relatives and fear of fatal end of the disease. And Rustox 30 and Arnica 30 for overexertion and overstraining. In August, the fear and anxiety were very much less. There was residual urine, and urine showed pus cells 30 to 40 per high power field. There were hot flushes in the afternoon and evening. So we gave Thuja 1M 3 times a day weekly, Lycopodium in the morning, Sepia in the evening, and Pulsatilla 200 twice a day. So this is how she is still being maintained, and she now says that I will not ever stop homeopathic medicine. And so with regular homeopathic treatment, antibiotic use was reduced to minimum, hardly, and relapses of UTI were very much reduced. Antibiotic resistant pattern changed and shifted towards first-line drugs as compared to third-line drugs earlier, giving great relief to the patient. She felt that she could do without prolapse surgery. So addition of homeopathy changes antibiotic sensitivity. It can be used in growing drug-resistant infection. She was a very regular patient with investigations, so we tabulated her chart, and it is showing that in the beginning, see the red is sensitivity. So you see the red very much less. And later on, she became sensitive to very many antibiotics of not only grade 1, grade 2 also. So she was very confident. She had a large spectrum of antibiotics. At the end, everyone goes to, wants to fall back on antibiotics. So had a large spectrum of antibiotics to be treated with, and she didn't have to go through surgery. And generally also she was very much better. So, bridging the gap, widening the horizons. Thank you.
Thank you, ma'am, for that excellent talk and your experience with those 2 cases. I have a question for you. You never mentioned anything about the culture for tuberculosis. How sure are you it was pulmonary, it was pot spine, and it could have been osteomyelitis, chronic osteomyelitis, because you've not given anti-tubercular drugs at all. First 4 weeks and then it was stopped, right? So how do you say that it was pot spine and it improved because of homeopathy?
The patient was first seen by the very experienced orthopedic surgeon, and it's a retrospective study because on the basis of radiological findings and she was termed as a case of pot spine or tubercular pathology. I understand that unless until you have culture positive, but there was no scope. See, the patient was so sick, and maybe the pus had gone for culture, but the family was so worried that they did not collect the report, or what happened to the report, I do not know.
See,
it
so
is a clinical
yeah, so the
diagnosis.
only thing is because you've given her all kinds of antibiotics later,
yeah,
along with that. So maybe it is not a case of pot
no,
spine.
we had not given any kind.
No, the other people did give antibiotics after.
Sorry, sir. She was given all anti-tubercular treatment. It was first generation AKT4 plus second generation of antibiotics.
That was only for 6 weeks, no?
Yes. So let me say, can I quote one? In an earlier case of genital tuberculosis, see, the patient biopsy showed it was full of tubercular bacilli. But that case, she had been given anti-tubercular treatment for 11 weeks, broken treatment, because she had developed a lot of drug intolerance. And after 11 weeks, the drug intolerance had become so acute that she could not be given any antibiotic. At that time, I took over that case and I treated her. And in 6-7 weeks' time, she had become so much better. The gynecologist asked for another biopsy, and that biopsy was not showing any bacteria. So that gave me the clue that, even in 11 weeks, if I say that my medicines have not, homeopathy has not helped, the antibiotics had made the patient sterile in 11 weeks. We can say that from that experience, and that is why here also I decided, though the orthopedic surgeon had said after 2.5 months that he gave the choice to me whether I continue with antibiotics or not, because he felt that the antibiotics are not working. But I thought, no, let me give for 3.5 months antibiotics. So yes, I take your point that it is not a culture diagnosed, culture DST proven tubercular case, but it is a chronic case in any case, and a very difficult case.
Yeah, thank you.